Welcome to this informational video on COVID-19. COVID-19, or the novel coronavirus disease discovered in 2019, has become the preeminent health crisis of our time. Though other pathogens like tuberculosis or smallpox have been more deadly, the rapid spread of the novel coronavirus has made it one of the most virulent in history. What is coronavirus? Coronavirus, as its name suggests, is a small, self-replicating germ. It is much smaller than a human cell or even a bacterium. It is in fact so small that it does not carry the basic necessities of life, meaning that in order for it to grow and divide, it has to infect another living cell. The danger for humans is that coronavirus replicates in the cells of human lungs. As it divides, it can do extensive damage both to the lungs as well as the immune cells of the body, which come to protect against the virus. In this way, it can cause a disease called acute respiratory distress syndrome, sometimes even severe acute respiratory distress syndrome, or SARS. If this is untreated, it can lead to uncontrolled damage of the lungs and, in the worst cases, even death. How does COVID-19 spread? The answer is with our help. Coronavirus needs a host for it to move from one person to another. This might involve either transferring through the touch of a surface, or, in other cases, directly being expelled from one person to another via a cough or a sneeze. Such a case can release a cloud of virus into the air, meaning that one person could potentially infect many others. What are the symptoms of COVID-19? The symptoms of COVID-19 are much like any other infection of the lungs. These include fevers, chills, meaning feeling cold, cough, especially worse or persistent cough, difficulty breathing, runny nose, headaches, and possibly muscle aches. None of these symptoms are specific for COVID-19, meaning if you have them, it does not mean you are infected with the novel coronavirus, but it does mean you may be at risk and you should get tested as soon as possible. How can we protect ourselves from the coronavirus? Remember, like all viruses, COVID-19 needs our help to spread from one person to another. The best way is to stop and contain ourselves. This means avoiding all unnecessary travel and, although tedious at times, staying home. If you do have to go out, wear a mask and make sure you're staying at least 6 feet away from other people. At this distance, the cloud of virus released when coughing or sneezing drops off significantly, meaning that you are much less likely to inhale harmful virus particles. This is all the more true if you're wearing a proper mask. Finally, do your very best to avoid public gatherings. At current rates, it is more likely than not that any large gatherings will have an infected person nearby. And remember, even if you feel you can tolerate the infection well because you're young and healthy, it does not mean that a loved one of yours who you may contract the virus to may be able to tolerate it as well. Stay safe, take care, and remember, please subscribe for more content like this.